So, this is Gilly Carter. This is my assessment video for the head, ears, eye, neck, and throat systems. If this was a real life setting, I would have already collected my subjective data, would have asked my patient, who is my dad for today, past medical history, family medical history, what he's here for, pain level, allergies, surgeries, anything like that. Then I would explain to him the physical assessment aspect of it, answer any of his questions, ask him to change it to a gown, and I would step out, I would collect my supplies. My supplies today are going to be a stethoscope, an alcohol to clean the stethoscope. If I had this, it would be a tongue blade and an eye chart. I have some gloves, a sink to wash my hands. After that, I would come in, and I'm going to first inspect the head for size and shape. So I'm just going to take a look here. Okay, what I'm seeing is that the head and the face are symmetrical. So now I'm just going to palpate the head for any masses. I'm going to touch you. Any tenderness?
No.
Okay. All right, good. So again, everything is within normal limits. Now I'm going to inspect the outer face, the eyes, the external eye. I'm going to look at the eyelashes. I'm going to look at the color. I'm going to lower this a little bit. Okay. So what I'm finding is that the eyes are symmetrical. Pupil size is symmetrical. Sclera is white. The mucous membranes are pink and moist. So now what I'm going to do is, if this again was a real life setting, I would explain my pen light procedure. I would turn off the lights, and what I would do is I'm going to come in with this pen light and check to see your pupils constrict. So I'm going to come in from either side, okay? Okay, you ready? Again, I would turn off the lights. Okay. Good. Okay. At this point, Perla was noted, and now I'm going to check for pupillary accommodation. So what I want you to do is you are going to stare at the tip of this pen light, and then you're going to stare at the tip of my ear. Pen light? Here. Good. Now, just keep looking forward and follow the tip of my pen light with your eyes, okay? Just your eyes. Good. Okay. I would be about 12 inches away from that. The last thing I'm going to do is test for convergence. So what I'm going to do is move this towards your forehead, and I want you to follow it. So basically your eyes might curve in, okay? Good. Okay, very good. So after this, I would check for visual acuity using the chart. Again, I don't have that, but what I would do is I would ask him if he wears glasses or contacts, which he does, and then I would have the chart, and I would have him read the smallest line on the chart, which we don't have, with both eyes. Then I would have him cover up one eye, read the smallest line, and then cover up the other eye and read the smallest line. After this, I'm going to move on to the ears. So what I'm going to do is I would stand behind the patient. I'm going to look at the ears. I'm going to look for size, symmetry. Okay. Can you turn slightly to the right? Slightly to the left? Okay, good. I'm looking for the shape, size, everything, again, seems to be within normal limits. According to Mom, no. Now I'm going to palpate the ears, which means I'm going to touch them. Hurt?
No.
Tenderness?
No.
Okay. I'm going to use my pen light. Pull back the penna. see, I didn't see any lesions. No nodules were felt, and no excessive cerumen noted. So now I would do a hearing test, and what I'm going to do is I'm going to stand behind you on either side, and you're going to just cover one earlobe, and I'm going to whisper 3 letters. So I'm going to go on your left side, okay? You ready?
So I cover up the right?
No, you cover up the left. Ready? C. What did I say?
A, B, C.
Okay, good. Now I'm going to go on this side. I'm going to say 3 numbers.
9, 10, 11.
Okay. All right. After that, I'm going to wash my hands by the sink. I'm going to don gloves, which I actually do have. And what I'm going to do is I'm going to move on to the nose. I'm going to inspect the nose. I'm going to check for symmetry, see if it's midline. There's no abnormal curvature. Okay. Again, patient seems to have everything within normal limits, and now I am going to palpate the nose. I'm going to check for nodules. Tenderness?
Nope.
Okay. Can you lean your head back? I'm just going to check the inside of your nares. Okay. Now cover up one nostril. And good. Do the other. Okay. Have you had any congestion lately? Okay. Let's see. The shape was normal. I didn't notice any polyps, no lesions, no inflammation or drainage. So again, everything seems to be within normal limits. I'm going to check his sinuses. So what I'm going to check is for the frontal and the maxillary sinuses. I'm going to check up here. So this is frontal. Tenderness, swelling?
None.
No congestion lately?
None.
Okay. All right, good. So I then checked the sinuses. There was no tenderness, no congestion, he states. So now I'm going to move on to the mouth. I'm going to inspect the outer mouth. I'm going to look at his lips. I'm going to check for the color. I'm going to check if they're chapped, if they're dry. Smile for me. Now show me your teeth. Okay. If I had a tongue blade, I would ask him to, I would retract the tongue and I would open up the mouth. So at this point, just say "aw."
Oh.
So I would have my tongue blade. Okay. I'm checking his uvula. I'm checking the back of his throat. Lift up your tongue for me. I'm checking his palates. I'm checking for lesions or any ulcerations. Checking for any dental caries or anything. Again, everything seems to be normal. Uvula is midline. I didn't see any inflammation of the tonsils. There was mucous membranes. The gums are nice, pink and moist. No evidence of lesions or any abnormal growths on his palates. So after that, I would have his tongue with a tongue blade, and I would move his tongue and try to go on either side of it. But again, I don't have that. So now I would take off my gloves. I would wash my hands, and I'm going to assess his lymph nodes. So with the pads of my fingers in a circular motion, I'm going to go underneath his tenderness. Okay, good. I checked that. I didn't feel any abnormal growths or anything. I was checking for size, mobility, enlargement, shape. So after this, I'm going to palpate his carotid arteries. So I'm going to feel for the trachea, which I'm already going to assess the trachea here. It's midline. Can you swallow for me? Have any issues swallowing? Okay. Okay, good. Now I'm going to auscultate the carotids. So I would do with my stethoscope. I'm going to clean the stethoscope with an alcohol pad. Listen. Turn your head slightly to the left. What I want you to do when I tell you to, take a deep breath in and hold it, and then let it out when I tell you to. Ready? Deep breath in. Hold. Good. Go towards the left. Same thing. Deep breath in. Perfect. Good. Okay. So I auscultated. I didn't hear any bruit, which is good. So now I am going to check his thyroid area from the neck to subclavicular. Checking for enlargement, swelling. I'm looking to see if there's any masses, any tenderness. Okay, good. So everything seemed to be again within normal limits. Last but not least, I'm going to check his range of motion in his neck. So what I want you to do is shin to chest. Now all the way back as far as you can. Now shoulder to shoulder. To the other side. Okay, all right. I could tell a little bit on this side. Not very good range of motion. But other than that, you seem pretty healthy, Dad.
Thank you.
All right.
All right.
This concludes my assessment video. Let me know what I need to work on. Thanks.
Thank you.